We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships. While the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show, the focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
And we're here live on Doctors Are People Too. Hello, South Florida and beyond, and globally on the iHeartRadio app and wherever else you're finding us tonight. We have some beautiful weather in South Florida. We're feeling great. We just come off of a big win with the Miami Dolphins there, so we're feeling great, and we'll talk more about football in a little bit. And we have a doctor who is also focused on great things, making people feel better. We're kind of putting them through the car wash here at the radio station, kind of like what they do on other stations where you see the doctor on a few shows, but that's great. I mean, that means that we have a really informative doctor in the area. And before I, keep going and get tongue-tied, I just want to introduce Dr. Luis Escobar. Dr. Escobar, how are you doing tonight?
Very good. Thank you, David, for having me and allow me to reach the millions of listeners that you have.
Oh, perfect. I mean, that's what we do on Doctors Are People Too. We want to give, people, driving around their cars around South Florida some information on these adventures of health. Now, you have a very interesting path in medicine. You are a practicing stem cell regenerative medicine physician, but you have a past in anesthesiology. Can you tell listeners a little bit how you got involved in regenerative medicine, and then also your past as an anesthesiologist, I guess in South Florida and beyond?
Sure, it'd be a pleasure, David. First, I think let's go start from the beginning. The beginning was the anesthesiology. That was my main specialty, primary specialty. We would train in providing patients with general anesthesia, but also regional anesthesia. Regional anesthesia refers to blocking of nerves for the surgeons to do surgeries without having the patient go to sleep. Then from there, this progressed into pain management, interventional pain management. And what we do is inject substances such as local anesthetics and steroids into areas that are painful, either close to nerves or around the nerves or in joints or in the spine. Then the practice progressed into what we concentrate in the most at this point, which is the introduction of stem cell and platelet-rich treatments to promote the regeneration of those injuries that we were treating for painful conditions before. So now we have the ability to treat the pain and to promote regeneration of the injured areas.
I want to touch on a topic that you brought to us and that I don't think we've had on the show before is interventional pain management. I think we've had some interventional cardiologists on. I think an interventional neurologist who treats strokes as well. Now, interventional pain management is something that you're really focused on, which is really neat and really neat sounding, but I know it ties into much more. Right into our next question. You have a practice here in South Florida that is participating, and this is something that's so futuristic to me, and we've heard it a little over the last few years, but it's something that is really here, and you're going to tell us about is stem cell therapy. So you actually have a practice in South Florida where patients can benefit from stem cell therapy.
Yes, indeed. We do have our offices in Hollywood, Aventura, and Pembroke Pines, where we actually are performing these procedures. This is an outpatient procedure where we harvest stem cells from the same patient. Together with platelet-rich plasma, we combine it, and we use this treatment to inject into the injured areas, name it In my practice, we specialize in the musculoskeletal system, which involves joints, tendons, muscles, and we are attempting to regenerate the injuries in those areas. Now, this is amenable to injuries, is amenable to degenerative diseases as well, such as osteoarthritis. So we are able to provide these treatments in the office as an outpatient procedure. This treatment takes approximately 2 hours from the time the patient comes in. It involves harvesting stem cells from either the patient's adipose tissue or from the bone as bone marrow, and some platelets from the circulating blood to obtain what is called the platelet-rich plasma combined and precisely injected after it's been processed via a special centrifuge, injected back into the injured areas. This has to be a precise injection to get the maximum result. So when I say precise, if you have an injured ACL, we have to go and by precisely identifying the ACL, we drive a needle either under direct fluoroscopy or ultrasonography or both into that particular tendon to inject inside the tendon itself to promote the regeneration.
Amazing. That is just amazing. And doctor, hold that thought because I want to give listeners where your office is located and the phone number as well, because you're actively doing stem cell therapy right here in South Florida. So we're here once again with Dr. Luis Escobar. He has offices with Pain Care Specialists of Florida. You're going to find him in Hollywood, Florida, in Broward County. Also in Aventura, Florida, in Miami-Dade County, and Pembroke Pines as well. The best number for the Broward offices is 954-322-8586, and in Miami is 305-932-8177. But even easier, nowadays with these smartphones and everything else, how we're moving so fastly, is painconsults.com. That's painconsults.com, painconsults.com, and you'll find a wealth of information there. As I did, I was able to do all these questions from just the website. So it's a man talking to Dr. Escobar. So you're saying, so these stem cells are pretty plentiful in the body, and someone like myself who is the size of a ballerina has not a lot of stem cells. No, just kidding. So I have a ton of stem cells to work with. Is that something you take them from the belly, and I think we were talking earlier, bone marrow as well?
Exactly. The most abundant areas, the stem cells live in all tissues of the body. Your synovial tissue, there's some of them circulating on the bloodstream. They're even on the teeth. We have stem cells. They're there awaiting to be called into action to repair injuries. The areas where the stem cells are the most common, the most abundant, are the bone marrow of the larger bones, such as the femur, or most commonly used, the pelvis, and the adipose tissue. The adipose tissue is by far more abundant in stem cells than any other tissue in the body. So we use these two areas to harvest stem cells whenever need be for a treatment of an injury. So the process will be the patient comes to the office. Patient has already been evaluated. We have identified an injured area, and we have arrived to the precise diagnosis. The patient will come in for a procedure, have been optimized, and we will do the harvesting. And once the harvesting is done of the stem cells and the platelet-rich plasma, we take the patient to the procedure room where we have the special equipment, name it fluoroscopy and ultrasonography, to drive these cells into the exact area of need.
Now, you mentioned you focus mostly on musculoskeletal, but Can these stem cells be used for neurological disorders? Are there any that maybe South Floridians or their family members could contact you or other doctors about?
Yes, stem cells are amenable to heal any injury in the body. There are studies around the world that have been using stem cells for, I believe, at least 30 different conditions. And these include, and you mentioned neurological, it has been used for multiple sclerosis abundantly. Stem cells have been used for ALS, Lou Gehrig's disease. They have been used for post-stroke patients that have a residual brain injury. Has been used for pulmonary problems like chronic obstructive pulmonary disease, COPD. Has been used for kidney disease. Patients that are close to or have already gone into dialysis because the kidneys have failed. Has been used on coronary artery disease or cardiomyopathy, insufficiency of the heart. So the uses are innumerable. Remember, we have those stem cells in the body to repair every tissue in the body. So once certain organ or certain tissue has gone awry, we can harvest stem cells, deliver them to the right area to reset the healing process and start the regeneration of those tissues.
Fascinating. I mean, this is really the neatest stuff I've heard in some time in the medical world. So I kind of felt, and I think maybe listeners may also felt that this was still a little ways off, but it is right here, Dr. Escobar. So thank you so much for sharing that. I want to ask you, do you need to be referred to talk to you about stem cell therapy, or is it something that they could call you, set up an appointment? And part B of that question is, let's talk about insurance. Does insurance cover stem cell therapy?
Unfortunately, at the present time, insurance does not cover stem cell treatments or platelet-rich plasma treatments. This is something that, depending on the area to be treated, will have a different cost for the patients. The way insurances are set up nowadays, stem cell treatment ends up being, in some instances, less expensive way to treat certain injuries or diseases, because what we're finding more and more, including on our own insurances, is that it's so expensive to use these insurances that sometimes the deductibles are more expensive than what the stem cell treatment will cost you. So I would recommend to your listeners that don't be discouraged by the fact that these are not covered by insurance, because it will be more affordable perhaps than having any insurance treatment. By far, it will be cheaper and faster to heal from this than from surgery, if that is the alternative.
Now, Dr. Escobar, hold that thought, because we're going to take a quick break, but I want listeners to know that they can visit painconsults.com to learn a little bit more about your practice in Hollywood, Aventura, and Pembroke Pines on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we're all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. what you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Okay. And we're back. Hello, South Florida and beyond. Welcome back to Doctors Are People Too. We're here with Dr. Luis Escobar, who specializes in pain management and regenerative medicine. And we were talking a lot about stem cell therapy, and I want to get right back into that question I asked you before the break. Can patients come directly to you for stem cell therapy, or do they have to be referred?
Very good question, David. Patients can call our office and they can request for an appointment. We request from the patients to bring all the studies they have to help us reach the right diagnosis and make sure that we are treating the right illness. And we can work directly with the patient's primary physician or specialist if they desire to do so. But any patient can call the office and request for an appointment. It will be a pleasure to evaluate him and treat him.
Now, staying on patients, what age range of patients do you provide treatments to?
We do not treat pediatrics, so anybody who has reached the age of 18 or older will be welcome in the office. I believe that we have a patient that is 103 years old, so at this point that will be our limit. But we are not discriminated against the 110-year-old patient out there.
Wow, 103-year-old, and we're seeing more of that. I mean, you're seeing more of that. People are living longer, and quality of life is important.
It is indeed. And we're seeing older population and with a very good quality of life.
Yeah, that just reminds me of something I know I'm going to face when I'm older, and I'm kind of skipping around a little bit here, but is all the broken fingers I've had over time. My grandfather had arthritis. I believe my dad has it. So can you also help with, joint pain as well, and kind of tell us some of the things you do for that?
Absolutely. It is a great illness to be treated by this mode of treatment. Osteoarthritis, if we catch it early enough, we can actually help regenerate the cartilage in the joints, and in the long run prevent the need for replacement surgery, which is the ultimate treatment for degenerative osteoarthritis, most commonly on the knees, the major joints, the knees, the hips, and nowadays even the shoulders. So if we start treating this with stem cell treatments, when this is moderate to severe, mild to moderate osteoarthritis, is very likely that we will help that patient prevent the need for surgery. Also, interesting, other types of arthritis are treated with this mode of treatment, and we have a treatment that we do a combination of local treatment together with intravenous infusion of the stem cells. So that way we're treating the local problem as well as the generalized problem when it exists, and we're having very good results with that mode of treatment.
Now, Dr. Escobar, I feel like we're having a consultation right in the office. You have a very calming voice, and I think you have a great bedside manner. So I want to give the listeners out your info one more time. It's painconsults.com. It's Dr. Luis Escobar. The best number in Broward County is 954-322-8586. That's for the Hollywood and Pembroke Pines office. Pembroke Pines is still in Broward County, right?
It is.
Okay,
it is.
South Broward County. I'm originally from Jupiter,
It is Broward County.
Okay.
It's Southwest Broward County. But all the phone number, it will follow us everywhere. You know?
All three.
These are internet phones, so you can dial the date number or the Broward number, and they will.
They're all interconnected.
Yes.
So let me give them out again. It's painconsults.com, and it's 954-322-8586. And you're in Hollywood, right off of Sheridan Street. You're in Aventura, right off Aventura Boulevard, and then in Pembroke Pines, off of Southwest 129th Avenue. While we're talking about offices, what hospitals are you on staff at here in South Florida?
We're in one of the tennis hospitals, and now it is the North campus of North Shore Hospital, formerly Florida Medical Center. Oddly enough, that's the first hospital that I had privileges when I first came to Florida. Very dear to me, Florida Medical Center, I still call it. I have a hard time changing its name. It's a great hospital. We spend many of days and nights practicing general anesthesia, cardiovascular anesthesia. And we also have privileges at Aventura Hospital Medical Center in Aventura.
Aventura is a beautiful area, too.
It is, indeed.
And that's Florida Medical Center, a campus of North Shore. Once again, Florida Medical Center, a campus of North Shore right there in Fort Lauderdale, very big hospital, doing some great things to help out patients with a variety of treatments. Seems like they treat everything, I think, over there, but mostly pediatrics we were talking about because anyone will treat pediatrics, but you know their focus is on other orthopedics. We talked about cardiology, heart, as well.
Correct.
Okay, good. I'm on the right track. And neurology, they have a lot of neurology cases there.
Yes, of course.
Okay, so that's Florida Medical Center, campus in North Shore. I want to get a little bit into the PRP injections because I read about that a lot on my own. That's plasma-rich platelet injections. How does platelet-rich plasma help with pain? We were talking earlier. You had an interesting anecdote to explain this.
The platelets are the first comers to heal any injuries. You know, the first and foremost function of platelets is clotting. So when you have, let's say, a cut in the skin, and you start bleeding, the platelets will rush through the bloodstream to that area to try to stop the bleeding. At the same time, they start the healing process. They call into place by different type of signaling. They call for different type of cells to come to the area. They cause the white cells, the red cells, and even some stem cells to help with the healing. What we call microsignaling, which is called a chemical that are released, including cytokines and growth factors such as interferon, interleukin, that they call all the cells to come into the area to promote the healing process. So what we use the platelets for, we take the platelets from the patient's bloodstream, centrifuge the cells, separate the cells that we don't need, such as the red cells or the white cells, and just keep the platelets with some plasma. And this is a very concentrated number of platelets, and then re-inject them into the injured area. Now, when the injury is a mild injury, this is enough to help promote the regeneration and healing of the area. When the injury is more advanced, what we do is we also harvest some stem cells, either from the adipose tissue or from the bone marrow, process them via special centrifuges, and then when they're ready, we combine them with the platelet-rich plasma and inject them into the injured area directly. In some type of diseases, we inject the injured area, and as I mentioned before, we will give back some of those stem cells intravenously back to the patient to recruit more cells, even more, to go into the injured area.
The workers, is that the way? That's the way I remember it before.
Right. The way to look at this is like the stem cells are pretty much the director or the quarterback, if you will, and then the platelets are pretty much the workers. The workers are gonna go and do
the offensive line.
the offensive line,
The defensive line.
the defensive line,
Yeah.
and the receivers. That's correct.
That's my guys, offense and defensive line. No, really, I was a defensive lineman. So, and obviously, I have a lot of stem cells. So, I may be coming your way with my ailments because I got a lot right here.
Oh, it would be an
do.
honor to treat you.
And we were just talking about football. I mean, you were just at a football game. You were at the weekend at the University of Miami in North Carolina, right?
Indeed. It was almost a great day because Miami was coming back to win, but it did not happen.
Yeah, but what do you think of the new stadium? I mean, I got to go there in September, and we talked a little bit on the show, but I'd like to get your perspective. Well, not new stadium, but the additions they made.
You know, it feels like a new stadium.
Doesn't it? It looks like one.
This is my first time back in the stadium since the renovation, and it's amazing. It is amazing. It's just, I don't have any better word for that. I enjoy myself. I enjoy the game. I enjoy the company.
That's nice. Do you treat a lot of athletes in your practice?
We do not treat any professional athletes at this time. We do treat a lot of sports people, you know, the non-professional athletes, and we treat a lot of the weekend warriors.
I was going to say that. You stood right out of my mouth. Weekend warriors, because we have great weather here in South Florida, but sometimes we do overdo it, right?
Absolutely. You know, I mean, it's amazing that younger kids and not so younger kids now are getting into these competitive sports, and they're very hard on the body, and they're very, very good at it. Name it was just skating or extreme skating or CrossFit, or it's amazing what these kids are doing with their bodies, and they end up having amazing injuries as well, because it's amazing all the sports that they're doing. So all these injuries are very amenable to be treated with stem cells and platelet-rich plasma. And the beauty of this is, even if you don't have any problems healing, this will improve and expedite the healing process, at least by 2/3 of what it will take to heal on its own, even if there's no issues healing properly.
They're like, skateboarding injuries, other injuries. I remember I used to skateboard as a kid, but then everyone would say, you know, certain moms would say, oh, my son's not playing football. But sometimes, man, skateboarding, those types of injuries with the concrete and stuff can be way worse.
Yeah, concrete tends to be a little hard sometimes.
And we even see injuries in cheerleading when maybe a cheerleader falls off the pyramid there.
You know, David, it's funny you said that, because I see some of these cheerleaders that are more athletic than I ever was.
Mm-hmm.
You know,
they're in great shape.
And I was a sports person, but I mean, it's amazing what they're doing. I mean, the pyramids, the jumping, the twisting, it's amazing.
The gymnasts in the Summer Olympics. I mean, I look forward to that more than anything else. I just think it's amazing how the way that sport has progressed.
It is. I would never attempt it.
No, and the injuries in that sport are horrific. The guy who dislocated his leg, and then the gymnast who kind of fell on her head, but she bounced right back from Great Britain. I mean, that was scary watching on TV.
You know, dislocations, those are injuries that very often are not responding very well to treatments, to conservative treatments. And there's some laxity sometimes of those tendons, that if we inject those tendons, all the supporting mechanism of the different joints with stem cells, it improves dramatically the performance of that joint going forward.
Dr. Escobar, we're almost out of time, but I want to give the listeners your info one more time. And please come back to the show, because I'd like to talk to you about, you have so many areas of interest that we only really got in stem cell therapy and PRP, but we'll have to tackle that. Let me give your info out again, though. Painconsults.com, very easy website, wealth of knowledge. It seems like you really keep your website updated, which is nice to see.
Well, yes, somebody does, yes.
Okay, well, hey, you're on it, though. I mean, that's important. I got to be honest with you. I've been to a few websites from physicians, and I don't know if that's a focus, but I that makes me think, you know, like you're on top of it. I mean, that's the way I think. So, painconsults.com, great website. Best number is 954-322-8586. That's for offices in Hollywood, Aventura, and Pembroke Pines. That's the pain care specialist of Florida. And Dr. Escobar is board certified by not only the American Board of Anesthesiology, but the American Board of Pain Medicine, and a diplomat with the American Academy of Pain Management. Wow, you've definitely done your boards, huh?
We did the rounds.
You did the rounds. Oh, and I got to mention, you and your staff are bilingual in English and Spanish. Huge for South Florida.
Yes.
So if you have any questions, you can call Dr. Escobar's office, whether it's insurances or his areas of interest. And definitely please come back on the show on Doctors Are People Too. We'd love to have you and talk a little bit more in the future.
Thank you so much for having me, David, and thank you to the listeners for putting up with me.
No, you were awesome. You were great. I really appreciate it. Thank you.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. Also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. Diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff. We're very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond, and globally on the iHeart Radio app. Welcome back to Doctors Are People Too. I'm so glad to have a pediatrician on the show tonight because I have a unique story from over the weekend. My wife is a pastry chef, as you may or may not know. She's a certified pastry chef. And we were delivering a wedding cake about 2 blocks from my mom's house in Jupiter. And it's actually my old pediatrician's house, Dr. Stevens. They had Dr. Stevens passed a few years ago, but his family sold the house and they gave it to some Veterans Foundation who do things for the soldiers coming back. And there was a wedding there, and it really came full circle. And I said, wow, this is happening the same weekend that I'm having a pediatrician on the show. So I guess that's how it works. But without further ado and no more stories on my part, I want to welcome Dr. Manuel Orta, a pediatrician and hospitalist at Palmetto General Hospital in Hialeah. Dr. Orta, how are you doing tonight?
I'm doing very well, thank you.
And thank you for calling in to Doctors Are People Too. I appreciate you taking the time. I know you're a very busy doctor because you are a pediatrician hospitalist, which I've never had on the show, and I'm going to have to ask you right out of the gates to explain that role for us, for me and the listeners.
Well, yeah, I mean, we're relatively busy, but I think all the pediatricians are busy. But as pediatric hospitalists, we only concentrate on the patients that get hospitalized. some pediatricians, and the ones that you're familiar with, are outpatient pediatricians. They take care of your child when it's healthy and when your child is having minor illnesses. But if they're sick enough to be hospitalized, I will be the one taking care of them in the hospital.
Okay, so you're the doctor in the hospital. If we, for God forbid, we have to bring our child in there, or not, you're the one in the hospital. You're the attending physician who will, most of the time, you or your team will see them first there at Palmetto General Hospital. Can you talk a little bit about the hospital and the pediatric care provided? Because I know you do focus on peds at the hospital.
Yes. So our services at Palmetto General Hospital, the pediatric services have been there for a long time, but recently the entire service went through a renovation, and we have new people coming into the team. I'm one of the new doctors there. I started in January. I was one of the first full-time doctors there since January this year. Now we have 3 doctors that are full-time hospitalists, including myself. We're there 24/7. Our patients are taken care of by us 24/7. So any patient that comes through the emergency room is seen first by the doctors in the emergency room, pediatric emergency room doctors, and then they call us if they need to keep the patient in the hospital. So we offer pretty much all the services that are needed, and so what we don't have yet is intensive care, but if we need that, we will provide that in other hospitals that are affiliated with us, or that we're affiliated with.
And thank you, Dr. Orta, for explaining that, because I got to admit, I was a little confused, and I just want to make sure the listeners are good with that. But, you are a pediatrician hospitalist in the hospital setting. And welcome aboard. I mean, you just started here in January, so you guys are building your program, it sounds, because you mentioned there's 3 now. And I just want to ask you, what are the most common ailments, if you can share with us, that you treat as a pediatrician in the hospital?
Most patients that get hospitalized to the great majority of children's hospitals are, secondary to respiratory issues like an asthma attack, an asthma exacerbation, or a significant pneumonia, or very young kids that have a bad cold, which we call bronchiolitis, and sometimes they require a little bit of observation and minor interventions. Those are the great majority of them. Other cases that we have are infections, such as skin infections or muscle infections and urinary tract infections. The other most common one is gastrointestinal infections as well. Like you have vomiting and diarrhea, and you're unable to maintain anything, by mouth. You're unable to drink fluids. You can become dehydrated quite quickly. So those patients sometimes they don't recover adequately in the emergency room, and we have to keep them for a few days until they are well enough to tolerate fluids by mouth. So those are the great majority of the patients. Then we have, of course, the very strange cases and the more rare diagnoses. But those are thankfully very rare. I mean, we don't get a lot of those, except major children's hospitals. They see them all the time because they're referral centers. But at Palmetto, we see the general bread and butter of pediatrics.
And that's Palmetto General Hospital. We're here with Dr. Manuel Orta on Doctors Are People Too. Palmetto General Hospital has a great website, very easy to find. You're just going to put in your browser palmettogeneral.com, and I have the number here is 305-823-5000. That's 305-823-5000, 5000. Now, we talked a little bit about asthma episodes, Dr. Orta, and I grew up with a friend who had asthma and always carried an inhaler. Luckily, she never had to use it, but and I never saw the actual episode. But sometimes asthma episodes can be that severe that they have to be brought in by their parents as an asthma attack. Is that kind of the more of things that you would see on a basis there as a pediatrician hospitalist?
Yeah, so a lot of kids come through the emergency room with asthma exacerbations. Thankfully, the great majority of them are able to be taken care of by the emergency room physicians. Some asthma exacerbations never make it to the hospital because the parents know how to handle it well. But those kids that do not respond to the initial interventions, that they go to the emergency room and we cannot turn them around, they have to stay with me in the hospital. And, we have to give them treatments more frequently, other kinds of treatments that cannot be given at home. They need monitoring. And those are the kids that need to stay with us. And the length of stay varies so much. I mean, it can be from 1 day to a week. It all depends on how long it takes for the kids to get better. It's really depending on the child.
And as a physician, you also work with the family, and I guess with asthma, well, a big thing would be education with the parents. Can you talk briefly about that as well?
Absolutely. I mean, you mentioned a very important point. A lot of cases that we see is cases that are, the parents don't know when to give the medication on time. They don't know how to react to the minor initial symptoms. And those symptoms of asthma can quickly escalate into something more serious. And the patients that we see in the hospital are usually the patients that don't get the treatments on time because the parents didn't know what to do. I mean, it's not the parents' fault. It's just didn't know how to give the medications. So education becomes an important part of what we do every day as outpatient pediatricians and inpatient pediatricians. So I always have a good line of communication with the pediatricians in the community when I admit a patient of their practice into my service. As soon as they're discharged, I talk to them. I tell them what I taught the patient. I usually provide a lot of education to my patients when they're in the hospital. That's what I spend most of my time with, is educating them how to use the medications, what are the triggers, what are the signs that are worrisome, because that's extremely important. That's just as important as, giving the actual medication, but knowing when to give them is key. So timing is very important, and the only way you can achieve that is by educating the parents.
Thank you for touching on that, because I feel that information is key. The more information we have, the better team we can build. Obviously, you're the expert, but if we can be team members, if you're the quarterback and we can, be members of the offensive line to push whatever we need to the children, I think that's important. So I don't think you could have put it better. That was awesome. I just want to ask you, I'm so lucky to have a show where I can talk to doctors regularly and kind of answer questions I have. So are children born with asthma, or is it genetic?
No. So asthma is an inflammatory condition. There is a genetic predisposition to develop asthma, but the fact that, let's say, your parents are asthmatic, you very likely will have a predisposition. Will have a predisposition to develop it. Doesn't mean that you will develop it necessarily. There are certain triggers, and it varies from person to person. It could be an allergy, it could be recurrent infections, it could be inflammation because you're surrounded by people who smoke around you. So there are many different triggers. So if you have the predisposition and you are not exposed to the triggers, you will not develop the disease. But there is a very strong genetic component. You're not born asthmatic. You become asthmatic in time, but you are born with a predisposition from your parents. It's a genetic predisposition. It's genetically indicated. Okay, but some kids without any family history of asthma can still develop asthma.
And we're here with Dr. Manuel Orta, pediatrician at Palmetto General Hospital. That's palmettogeneral.com, and 305-823-5000, 305-823-5000. Palmetto General Hospital, located at 2001 West 68th Street in Hialeah. Dr. Orta, stay with us. We're going to take a quick break on Doctors Are People Too and come back on the other side and talk a little bit more about your areas of interest and what you see in the hospital setting on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like it's somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
We're here with Dr. Emmanuel Orta, pediatrician, hospitalist, Palmetto General Hospital in Hialeah. That's palmettogeneral.com, 305-823-5000. Dr. Orta, I want to ask you a question. It sounds like an easy question, but I think it's important. What age range of patients do you treat?
So, in Palmetto, we treat from 0 to 18 years of age. That's considered pediatrics. And that's pretty much the same case around the country in most pediatric hospitals.
Okay, that's great to know. It sounds like an easy question, but I think it's good to get it out there. Do you also treat allergies as a pediatrician? Do you see some reactions that bring, I guess, children into the hospital? Are they that bad?
So as an inpatient pediatrician, I do treat some allergic reactions, but those are severe allergic reactions. Sometimes it can be very serious. Some allergic reactions can be life-threatening, and thankfully we don't see that too often. If a child has a serious adverse reaction, sometimes they have to stay for observation just to make sure they don't have any relapses or anything like that during the first 24 to 48 hours. Yeah.
Well, it sounds like you have a very careful, thorough process there, and that's great to hear. I want to ask you a little bit about autism because it seems to be always in the news, and something that I think can be a little confusing to someone without a lot of medical knowledge. What exactly is autism, and is it something that is diagnosed by a pediatrician?
Autism, gets a lot of media attention with good reason. I mean, autism is a very concerning condition for us as pediatricians, for the parents, of course. Autism is a neurodevelopmental disorder that affects speech and the socialization skills of a patient. So the social interactions with their environment, in terms of eye contact, being able to communicate directly with a patient, to engage in conversation, to engage in any other activity with other person, that tends to be impaired to some level. It's very variable. It could be very minor. It could be very severe. And they usually have some sort of speech impairment or a delay of the speech. Usually they go together. There are other aspects that can also occur at the same time, such as cognitive delays, the inability to learn easily, or learning disabilities of specific matters like math learning disability or reading learning disability. But those are additional problems that can be present, but do not necessarily have to be present. It can definitely be diagnosed by a pediatrician. It's a quite common disorder, unfortunately. And I worked as an outpatient pediatrician for a long time, and I definitely diagnosed a few children with autism. Sometimes the diagnosis is not that clear, and that's when we should be referring to specialists for help in making the final diagnosis. The diagnosis is important not to label the kid with anything, but to be able to provide them with the services they need. Autism, unfortunately, doesn't have any cure, as far as we know, as of yet. But if they receive the services of speech therapy, physical therapy, occupational therapy, they tend to overcome a lot of the disabilities, and a lot of kids do very, very well.
Thank you for touching on that. And I mentioned team before, and it sounds like you have a great team. So you know specialists around South Florida, and is that how autism is treated, kind of in a team way with obviously a pediatrician, but then specialists in your medical knowledge, your medical community?
Yeah. So the word team here is key. You really have, in order to be a good doctor, you have to have a good team. Not only a good team of nurses, but a good team of specialists and a good referral network. You need to work. You need to make sure that you work together. Usually, the general pediatrician, the pediatrician in the community, they're the captains of the ship. They're the ones that should be steering the ship and making sure that every part of the team is working together. I'm happy to be one part of that team, and but the team approach in autism, in this particular example, is paramount. You need to use your therapist, you need to use your specialists, you name it, social workers, etc. Whatever service you need to be able to provide.
That's a great anecdote as well, Dr. Orta. I just want to give out the information one more time. PalmettoGeneral.com. That's Palmetto General Hospital, 305-823-5000, located at 2001 West 68th Street in Hialeah. I want to also touch on ADHD. I believe it's attention. You'll have to help me with the attention deficit hyperactive disorder, and if I butchered that, please fix it. And I think I did. So how does a pediatrician diagnose and provide treatment for that? And does that tie into autism as well?
Well, it's not related to autism.
Okay, good.
Some cases you can have the occurrence of both, but it's not related to the diagnosis of autism in and of itself. But ADHD, attention deficit and hyperactivity disorder, just like you said, it's a very common condition in pediatrics. It's one of the most common diagnoses in pediatrics, and any pediatrician should be able to diagnose it adequately. It's, like I said, it's very common. It's believed about 10% of the population have some degree of ADHD, believe it or not. But the great majority of people are not diagnosed, and the diagnosis can get a long time. A lot of these kids are picked up later on in life, usually around 6 to 9 years old, but the symptoms are present since the beginning of their lives. And I was just talking to a medical student today in the hospital, and I was teaching her that this is an inhibition problem. These patients do not know how to repress some of their impulses, and that can affect not only learning, but also the social interactions and all the aspects of their lives. And it's very important to make the right diagnosis. It should not be made lightly, because this is a label that sticks with them the rest of their lives. And it should be made when you're 100% sure that this is what it is. And I'm saying this because we get a lot of referrals when you're an outpatient pediatrician from the schools with the label already. A lot of people are labeled already before seeing a physician, and that's something that should be paid attention to. I mean, the parents should not jump into conclusions just because somebody at school or one of my friends mentioned it. Okay, the diagnosis should be made by a doctor, especially the pediatrician.
Now let's kind of go on to another level here off that topic. Something that's been in the news a lot is vaccines, and I wanted to ask you, while we have a pediatrician this evening, why are vaccines important?
Well, vaccines are important because they help us prevent serious diseases, diseases that can be life-threatening or that can cause significant amount of physical or mental impairment. All vaccines are safe, and before they get approved, there is a lot of research and studies done in order to back up their safety. You should, I always recommend that all parents should abide by the schedule recommended by the pediatrician. The pediatrician is the expert in vaccinations, and they should ask the pediatrician any question they have about vaccines. And if they're hesitant about anything, they should bring it up to discussion with the pediatrician in order to clear all their doubts or to educate themselves a little bit better about the vaccinations.
That is a great answer, Dr. Orta. I'm really glad that we got to that question. We have about less than 2 minutes. I want to talk about kids' medical services because you are a pediatrician on staff at Palmetto General Hospital, but can you tell us a little bit more about how kids' medical services serves at other tenant hospitals across the Tri-County area?
Yes. So I'm part of Kids Medical Services, which is a large multi-specialty pediatric group that services many different hospitals, like you mentioned, in West Palm area, Broward, Dade. In the area, in the surrounding community. I'm in West Boca, for example, and Palmetto as well. And we have all the specialties, and the specialists are available through the group. It's if I believe the last time I checked, it was like 200 and something doctors, and we provide from neonatology to pediatric ICU, to hematology, oncology, nephrology, pulmonology. All the services that you would need in the pediatric world are provided by Kids Medical.
Dr. Orta, great job tonight on Doctors Are People Too. We touched on so many issues, and I want to give out the information one more time. That's Dr. Manuel Orta, pediatrician hospitalist at Palmetto General Hospital. That's palmettogeneral.com, 305-823-5000. Dr. Orta, thank you so much for coming on Doctors Are People Too, and don't hesitate to come on in the future, please. That was awesome.
Thank you. I would love to talk to you again. Thank you so much.
Thank you.
Yeah, good one.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.